Good afternoon, and again, as always, it's nice to be with you on this Tuesday afternoon. We're looking forward to updating you on not just our numbers and our tier assignments for the week, but also a few important messages really on supporting older Californians, our seniors, those we may be living with who have underlying conditions, and ensuring that we're doing all we can to keep our guard up. But as I have done the last couple of weeks, I want to invite up my colleague, our acting state health officer, Dr. Erica Pond, to really walk through some of the data and where we are in testing.
Good afternoon, everyone. Thank you very much. So for today's case numbers, we have 2630 for September 22nd today, and our 7-day average is 3,473 cases. Our total tests are 131,273, and our 14-day test positivity is 3.0%. It's very important to us that our testing is accessible, timely, and equitable. It's critical to our continued response to COVID-19. Our test turnaround times within 24 to 48 hours allow for effective isolation and quarantine, which allow us to stop the spread of the virus. Laboratories across the state are reporting results in 1.2 days, with 69% being reported within 1 day and 90% within 2 days. This is a dramatic improvement in our turnaround time within the state of California. We have a new testing turnaround time dashboard that's updated weekly at testing.covid19.ca.gov. Given this, California's testing task force has issued updated guidance and is now recommending prioritizing testing of all patient population tiers equally. California has a new blueprint for reducing COVID-19 with slow and stringent criteria for loosening and tightening restrictions on activities. Every county is assigned to a tier based on its test positivity and adjusted case rate for tier assignment, including metrics from the last 3 weeks. And from here, I'm going to turn this back over to Secretary Ghaly.
Thanks, Dr. Pond. Just to re-emphasize, you'll remember really my first Zoom update on Tuesday, we focused on the new testing prioritization criteria. It's been many weeks since we spoke to that, and it was really built around the fact that at that time we were experiencing delays in turnaround time. There were access to testing issues that had popped up. Really, that was the impetus to our Perkin-Elmer partnership to bring new testing capacity to the state. But what Dr. Pond has focused on over the past couple of weeks is really an arrival to a different time where testing is more available, that turnaround times are shortened so that those test results can be more useful both to the individual who was tested, but also on the contact tracing effort from the perspective of isolation and making sure that those who are directed to isolate for a period of time do so early on in their course so we don't have the disease and transmission spread more broadly. So today's announcement focused on really changing our prioritization to say all 4 of our tiers, the tiers aren't different, but that all of them can be tested now, and that we want to support individuals who are in any of those tiers to get tested at the same rate. Again, if things do go to a place where we need to revise that because there's pressure on testing, we now have a system where we can do that. So on the blueprint, this concept of slow and stringent is really where we started many weeks ago, the governor laying that out for us and really looking at how we're going to see movement into the tiers. We had announced, really just as a reminder, that we have these 4 tiers. We have widespread, substantial, moderate, minimal. That's people are starting to talk about purple tier, red tier, orange tier, and yellow tier. That I wanted to, before we get into where we are today and over the last couple of weeks with data and where counties land, remind you of where these tiers are. I want to also say that although we'll focus on those counties making meaningful movement in the tiering system, so actually those that are changing tiers, a number of counties also did enough to control transmission that they're moving towards a change in tier. Some of these counties may be the county that you live in, and so we constantly urge you to go to our covid19.ca.gov website, where you can get all of the information about each tier and which counties land where. I also wanted to mention that, as we said in the beginning, we really wanted to stick to our framework for a minimum number of weeks. That minimum was 3. And today, after consideration from a number of different sources, looking at the evidence, understanding how sectors fit into our entire framework, we are announcing a move, and we will be working with our counties and our local sector leaders around nail salons being able to move into the purple tier. So statewide nail salons allowed to begin operations. We'll be giving more information about that soon, but that is something that we're announcing today as we look at these different tiers. That will be in the purple tier once again, so widespread statewide, looking at the operations of nail salons, understanding the number of steps that they can take to make a lower risk environment for both staff and customers, with some new additions to that sector guidance and how to set up operations in a way that is lower risk. We believe that it is, we're able to add that to the number of sectors within the purple tier, or that widespread tier. So today you'll see a number of counties moving from red into the red tier from purple, a number of others moving from red to orange, and then one moving from orange to yellow. So the red tier, again, substantial transmission. Alameda, Riverside, San Luis Obispo, San Mateo, and Solano counties all reaching the thresholds for 2 consecutive weeks, moving from purple to red. In terms of orange, moving from red to orange, we saw El Dorado, Lassen, and Nevada counties all moving there because they met the threshold criteria for 2 consecutive weeks and remained in the orange tier for at least 3 weeks before, in the red tier before moving to orange. And then one county, Mariposa, who met the threshold to move into yellow. This is, I think, a proof point that as counties are able to move, that we see them moving at all levels of transmission. So some that are just now getting case rates and test positivity down from what were pretty high rates in the late summer to being reduced, allowing those counties to move from purple to red, but even smaller counties where transmission continues to come down, as in the case of Mariposa County, seeing some counties achieve the yellow tier threshold as well. So I think good news all around, but really a reminder that we, despite seeing this steady downward trajectory, that we cannot drop our guard. People ask me on an ongoing basis, why the slow and stringent approach? And I'll remind you, we want to be slow and stringent so as we move forward, we can be best prepared in case we see some increase in transmission, that it doesn't cause us to take one giant step backward. This week, we had conversations with a number of counties about making sure that the data trends continue to improve. We looked at the data very closely across a number of counties, hand in hand in partnership with those counties to understand what they're seeing and to ensure that our thresholds are met and our data is accurate. We are seeing across the nation an increase in a number of states. We're seeing a second wave starting in Europe. Some European countries are returning back to stricter stay-at-home-like orders, some additional restrictions that, of course, we've seen here in California. We were the first state to implement that statewide stay-at-home order, but we are doing all that we can to make sure our counties can avoid a step back in that way to a more restrictive level of operation. And then, as we've reminded you time and time again over the past many weeks, the flu season right around the corner. There are already conversations about how our facilities are addressing flu vaccination, creating safe, lower risk outdoor ways to provide flu vaccine to a number of Californians, and of course, our emergency rooms, hospitals, urgent cares, and clinics preparing for flu coming through their doors, making sure that we have the right PPE and testing available so that if flu does come or when it does come, we are as prepared as possible to not just take care of flu, but to distinguish it from COVID. And I'll remind you that it's never too much to plug the flu vaccine. I received mine just yesterday. I hope that many of you will reach out to your provider. If you have one, identify when you can get that flu shot. And if you don't have one, to look at your county public health webpage or the state CDPH webpage to learn where you might be able to access flu vaccines at no cost or low cost. So again, we end every week with this point that simple acts make a big difference, not just for COVID, but for flu. That wearing your mask, ensuring that you have your face covering with you, that you don't take it off when you think it's okay to put your guard down. Keep it up a little longer than you thought you would, just to make sure that we keep transmission of what has become a real sneaky and swift virus that increases transmission in rapid ways across the state. Maintaining that 6 feet of distance. I'll remind you that so many people focus on wearing the mask as they should, but that additional physical distancing can make an important difference. Washing your hands and minimizing mixing. And by way of ending, we've seen a number of young people become infected as college campuses reopen. The identification, not just because we're testing more, but because of the environment on some of our college campuses, that transmission can occur. And as those college students, some of whom do end up becoming sick enough to be hospitalized, thankfully, not so much on the worst outcome of death, but more importantly, really, is their ability to spread to vulnerable Californians, older family members, maybe mom and dad, maybe aunt and uncle, grandma and grandpa, but really throughout their communities, and making sure as we welcome young people home for maybe a long weekend after being on college campuses, that we do what we can to keep ourselves safe. And really, if anyone at a college campus is infected, that we really work with those campuses to make sure that we minimize mixing in our broader communities and homes away from that campus. This will be an important message that we continue to highlight as we move forward through the fall and winter. So with that, I'll turn it over for the first question.
Ryan Malley, AP.
Hi, Dr. Ghaly. I'm wondering, is the state prepared to step up enforcement if businesses in different places follow through on threats to more quickly reopen than state guidelines allow? There was some kind of a rally in front of the Fresno City Hall yesterday where business owners said they plan to open October 1st, whether or not they've moved up into the next tier or not.
Yeah, so we've been working with a number of counties, and where I first go is continuing to work with the counties, both the elected leaders, the public health leaders, to ensure we do all we can to get transmission down, so those businesses seeking to reopen can follow our blueprint and our entire framework and move forward. In the case of some of the counties, Fresno, others in the Central Valley and throughout the state, we're seeing steady progress, and that's why I urge all of us to continue to look at the updates, not just for those counties that made a move in the tiers, but those who are nearing a move in the tiers, and watching that data improve. I think that should be hopefully a proof point to many of the business owners that they and the rest of our community is doing the right things to get transmission down, and that we will soon see more communities and businesses have a chance to begin operations. From the enforcement perspective, we are working statewide and with all of state government and our local partners to ensure that when enforcement is appropriate, that we do take steps to enforce these guidelines and these this entire framework. as it's important for us to continue moving through this in this slow and stringent way so we don't later in the fall have to make a big step backwards when we know that being outdoors is a little bit more challenging when flu is rearing its head in a more dramatic way than we see today.
Matt Hoffman, KPBS.
Hi, Dr. Ghaly. As the latest update, San Diego is staying in the red tier after having a week of purple data. To get to that 6.9 adjusted case rate, I know you touched on college campuses earlier. Did the state make any exemptions for San Diego State students? County officials have been asking you for that. Or are there any other concessions to have our county stay in the red?
Yeah, we did not. And I think this was an important point. We made this point last week. Part of the reason why we asked counties for 2 consecutive weeks is so we don't have a sudden reaction to what is a short-term trend. We included the San Diego State University numbers that we received in all of our calculations. We worked closely with San Diego County over the past, not just last week, but really intensely over the last week to make sure we all understood the data and that we understood where the county landed in the framework. There were no concessions made based on their data, and we look closely at San Diego's data the same way we do all of the other counties across the state.
Adam Rakusin, ABC 10.
Yeah, hi, Dr. Ghaly. So following up on San Diego's been straddling that substantial and widespread. It's the case rate that has been in that substantial category and what's getting the county in trouble. What conversations have you had with county leaders, and what are you seeing exactly when you look at San Diego's data?
So we certainly see a county that is hovering around that threshold between red and purple, but we continue to have conversations about how we at the state can support San Diego, as well as understanding more and more what San Diego is doing around places like San Diego State University to curtail or limit transmission. I think those conversations have been very positive. We've had a number of conversations, not just with public health leaders, but some of the other leaders in San Diego County to ensure that the state is receiving all of the data. And we've been very clear that the framework is our framework. We're going to continue to follow the data. We believe we built something that follows this slow and stringent principle, and that if San Diego County, just like any other county, misses our thresholds, that is going to trigger those more intense conversations which we've had to focus on all of the areas of transmission. And we felt not because of a personal or subjective opinion that we received after having conversations with San Diego, but that we built a process that was based on the concrete data that we received, and that they should remain in the red tier at least for this week. And like we do every week, we'll continue to look at this, and if the data points in a different direction, that's the direction we'll move in.
Samantha Young, Kaiser Health News.
Hi, Dr. Ghaly. I was hoping you could weigh in on the controversy about the CDC and the guidance they issued on Friday and then pulled back on regarding the spread of COVID based on the droplets versus airborne. And that's quite a distinction. And how does that impact the guidance that the state of California has put out, which of course is based on droplet precautions and the implications that it could have for reopening these different sectors in California?
Yeah, I think it's an excellent question, one we talk about not just because of the CDC, but an ongoing basis to make sure we're following the science on this important distinction. The bottom line is, and this is true for most of our sectors and all of our population across the state, that the same protective measures are important, that we continue to minimize our mixing, that we continue to wear our face covering, and that we keep physically distanced when we're able to. And that when we're not, that it's even more important to make sure that our face is covered, both our mouth and our nose, so that we avoid any transmission. The truth is that between droplets and aerosolize the smaller particles, that there's a lot of space in between, and that it lives on a continuum, and that continuum is important. That we're all very knowledgeable that there's ways for this virus to be transmitted, and keeping our guard up in whatever setting we're in, indoor, outdoor, trying to avoid some of the indoor experiences that we enjoyed before COVID are very important to reduce the transmission overall. And I think our messages across California are going to continue to be those that we've been emphasizing over the last many weeks, even as this science shifts. If we see an important proof point in the science and the information to radically change our guidance, we will do that as well.
Paul Sijan, San Diego Union Tribune.
Hi, I just wanted to clarify that San Diego, because it posted a red score this week, would technically need to have 2 purple scores in consecutive following weeks in order to fall down to the purple tier. San Diego is not going to be held accountable for its purple score last week. Is that right?
Yeah, it's again emphasizing it's 2 consecutive weeks. So it's not 2 weeks over 3 or 2 out of 4, it's 2 consecutive weeks. And really the point of that is to make sure we understand what the trends of transmission are. We know that counties do a lot, and the whole point of contact tracing and supportive isolation is to be able to find those cases and then do something about it to control transmission. So that's why we look at 2 consecutive weeks. And indeed, San Diego is essentially at 0 weeks towards moving backwards. It would take 2 more in the purple tier before that county, or any county for that matter, would move from red into purple.
Sophia Bolog, the Sacramento Bee.
Hi, Dr. Ghaly. I had asked you a couple of weeks ago whether you were seeing evidence that this new tiered system is indeed working better and is understood better by counties. And you said at the time that it sort of was too soon to say. I'm wondering if you can say this week whether there is evidence that it's working better, and if so, what evidence you would point to. And if it is still too soon, when would you expect to be able to say whether this system is indeed working better than the old one?
Yeah, great question, Sophia. I think that certainly we feel like it is a clear way to communicate. We have the tiers. We understand which sectors are operating at what level in each tier. The thresholds, the metrics have clear cutoffs. We're looking at those week over week in the same sort of dialogue that we have from each county. So I would say that those conversations are becoming easier. People understand it in a clearer way than I would say our first framework. The evidence that we're seeing continued stabilization and reduction in our metrics, despite some sectors increasing their operations, to me is one of the strongest proof points that we can begin to have this slow and stringent reopening plan for our economic sectors while not seeing any early signs of increased transmission or any reason to move backwards. I would say that I will reserve final judgment for a couple of more weeks until we really see how Labor Day data, as well as how some of the other increases in operations of our sectors impact those numbers across the state. But so far, I feel like we've seen a number of proof points that this is indeed a simpler way to communicate and work with our counties and frankly our entire public, as well as something that is bearing out in the data and what we've seen in terms of forward movement across many different counties and across each tier. I'll just highlight that we had counties move from all of the different tiers into a less restrictive tier this week, and we anticipate that we may see more of that even next week.
Anna Ibarra, How Matters.
Hey, Dr. Ghaly. I'm wondering if we can get an update on contact tracing efforts. So just last month, counties were reporting having a backlog of cases and sort of having to prioritize which cases they investigated and traced. Some of it due to the long waits on results and also just not having enough manpower. So as you and Dr. Pond have shared, that test turnaround time has decreased. So wondering if this means that counties are having an easier time doing contact tracing. Are they keeping up? And is this contributing in part to the decreasing case rates? And on that point, last month the governor also announced that philanthropy had raised $18 million to increase contact tracing in counties. So just wanted to check in on that and how that's helped.
Yeah, no, all great points, and one we think about very often. In fact, over the past couple of weeks, we've been surveying many of the counties, trying to understand exactly your question, making sure that it's in place. You'll remember I talked about how we wanted to bring cases down, increase our ability and capability around contact tracing, so it hits a sort of equilibrium point where counties can, in fact, not just do the requisite case identification and disease investigation with that initial case, but reach a number of the contacts. The survey results, which we'll share in more detail soon, identified that a vast majority of the county are in fact sufficiently staffed with disease investigation and contact tracing staff to not only reach out to those cases, upwards of 95% of cases within 24 hours in some counties, but then also their contacts, identifying those contacts, making sure that if they need testing, that they get it, as well as having the resources and supports to isolate effectively. In terms of our philanthropic partnerships that we are deeply grateful for those contributions, this sort of sense that it's all of California working together here, really have started to blossom in some of our communities across the state. Central Valley counties working with those dollars, getting them into supportive isolation entities, working with our community-based organizations to make sure that we have the resources to not just make that phone call, provide a little bit of advice, but hopefully provide real resources so that individuals who are able to isolate successfully have all that they need to be able to not just support themselves, but their families to do that effectively. I believe that this is not just a theoretically an important strategy to reduce transmission, but those efforts across counties, big and small, are indeed making the kind of difference in the data that we're seeing now.
Tom Kiskin, Ventura County Star.
Yes, sir. So today at the Ventura County Board of Supervisors meeting, there was discussion about the county's efforts or requests for adjustments that would enable them to meet standards for the red metric. And county leaders said that they were told, in fact today by you, that that would not immediately happen. Can you explain this situation?
Sure. It was, as many counties do, they reached out to have a conversation about some of the trends that they're seeing. And it was, as always, a really good conversation about some of the tremendous efforts in Ventura, just like I hear about in other counties, to focus on issues of supporting populations that have been disproportionately impacted. The tremendous effort, not just with state testing sites, but county-sponsored sites for testing throughout that county. I mean, really a tremendous effort. And I think you're seeing that in their outcomes, right? We're seeing the case rates coming down. We're seeing test positivity come down. My message to Ventura County, as it is with every county, is we have our framework. We're encouraged by the movement counties are making towards achieving those thresholds to move into the framework, or to move into a different tier. But we have our framework. We believe that it's working, and we're there to support each county in their pursuit to move their own transmission down, their own test positivity down, so a county like Ventura can move from purple to red. But we're not going to compromise the process that we've set out now. As an earlier question asked, do we think it's working? We do, and we think that it's going to continue to work county by county across the state.
Claudia Pesueta, KNX News Radio.
Hi, I'm wondering when the health equity metric is coming and when it might begin playing a role in the tier system. Could some of the counties end up going backwards once that metric is introduced? Thank you.
Yeah, it's a great question. As I said late last week, we continue to work with our counties to get this one right. We believe it's such an important metric, both in the context of COVID and all the work we're doing, but in the broad context of health equity and equity in general. The disproportionate impact on certain populations is real. We've been tracking it through our data. So many counties, I heard a little bit about Ventura County's efforts, not just this morning, but later last week. around focusing on equity. So we believe that we're going to find a metric working with those counties that not only can be implemented, but through the tremendous effort that we're already seeing and building on that each county can be successful. And rather than seeing it as something that was going to push counties backwards, that it creates an opportunity for every county to shine in this regard and help support them to move it forward. We will pick a metric that by focusing on not just the quote equity metric, that they're really working on transmission generally in the county and able to facilitate the forward movement through the tiers because of that focused effort around populations that are disproportionately impacted in the data today.
Victoria Colliver, Politico.
Hi, Dr. Ghaly. Thank you for taking the question. So I'm sure San Diego was very relieved, but San Diego and Orange County today, they held a press conference, and basically for businesses, they're saying they just don't think they can survive with restaurants at 25%, gyms at 10%. How are you working with the business community to ensure they keep working with you? Are you concerned the slow and stringent approach may prompt non-compliance? And also, it seems like the pushback from at least the nail salon industry affected how that played out.
Yeah, I mean, great questions. We, through not just Health and Human Services or California Department of Public Health, but a number of our agencies and entities at the state level have had ongoing interactions with a number of the different business sectors, often in a lot of back and forth communication about what steps people take to create those lower risk environments. We're, of course, very sensitive and interested to support our economic sectors across the state. It's the engine for so much that drives health. I mean, jobs, housing, many of the resources that flow through businesses into our workforce are a critical piece of preserving public health. So we're very in tune and sensitive to that. And our whole approach with slow and stringent really comes from the lessons of earlier in the late spring and early summer, where we saw transmission really increase rapidly and a push to move some businesses that had just gotten started to close their doors or reduce their level of operation. So this approach, although we're starting to see some movement now, and I think tremendous movement this week, counties not just from purple to orange, but purple to red, but red to orange, and orange to yellow now, that it is beginning to move. And we are working closely with a number of our counties and our business leaders to see how we can continue to hold on to get transmission to drop in those counties so we don't run the risk of moving backwards. So it's an ongoing conversation. I know personally that I'm having a number of those conversations myself, but all of state government, the entire team of the governor is working closely with a number of those leaders. And not only do we hope, but we expect that we'll be able to continue to work with them to make sure that we get through this and we get through the fall and winter and flu season, and that we're moving forward with increasing economic stimulus throughout those sectors.
Nora Michanik, San Francisco Chronicle.
Hi, my question is about San Francisco. I know a lot of officials locally had expressed confidence that the city would move and the county would move into the orange tier. That doesn't appear to have happened today. What do those conversations look like?
Yeah, similar to a number of other counties, you know, when a county asks us to take a close look at their data because it might impact their tier assignment, we do that. We receive that request from San Francisco, and that's an ongoing effort with them to make sure that we have accurate data and that tier assignment is accurate.
Final question, Brandon Lewis, CBS San Diego.
Thank you. Are you finding the 7-day lag used to calculate case rate is effective? Because when we look back at a longer lag before today, after all the data was added for San Diego, it hasn't been below 7.0 since August 31st, which certainly would have put it into the purple tier well before.
Yeah, we've looked at this pretty closely and landed on a 7-day lag for a number of reasons, so that we ensure that our data is current and reflective of what's happening currently, and that we leave some space to allow us to capture test results and data that might have been lagging. Certainly there are some that say a shorter lag is more appropriate, some that say a longer lag is more appropriate. In our looking at certain counties, we see that this approach allows us to capture a vast percentage, a very high percentage of all of the relevant data without risking being a little dated or stale with the data that we're using to make real-time decisions. So I think there's a lot of different opinions and approaches on this. We believe we've chosen something that allows us to benefit from having complete data while also being current in the decisions that we're making for counties, as we know that they want us to take a look at, and we want to take a look at, actual levels of transmission at the moment that we're making the decisions that we are. So with that, thank you again for all of the questions. I know a busy week of conversations with counties. I just want to say a deep thanks to the counties, not only as they're looking at their own data, understanding the conditions within their own counties, but really leading in these conversations with us at the state level so that we can continue on this approach that we believe is going to continue to carry us through. So with that, thank you very much and have a good afternoon.